What is Crohn's disease, you might wonder? Well, it's a significant question, with an answer that has evolved over the years. Crohn's disease, a type of inflammatory bowel disease, has puzzled and challenged medical professionals since its documentation in the early part of the 20th century. Dr. Burrell B. Crohn, along with his colleagues Dr. Leon Ginsberg and Dr. Gordon D. Oppenheimer, first described the ailment in 1932. They outlined the characteristics of what we now know as Crohn's disease, chronic inflammation that can affect any part of the digestive tract. The progression of understanding Crohn's disease has been a journey. In the initial years, the disease was often mistaken for tuberculosis due to similar symptoms. It wasn't until the 1950s that Crohn's was recognized as a distinct entity, separate from other gastrointestinal disorders. The 60s and 70s witnessed advancements in diagnostic technology, leading to increased detection rates. The 80s and 90s brought forth new treatment options, including the introduction of biologic therapies in the late 90s. Fast forward to the early 21st century, and we see a significant rise in the prevalence of Crohn's disease around the globe. The reasons for this increase are still under investigation, but experts suggest that changes in diet, environment, and lifestyle may play a role. Despite the challenges, research into Crohn's disease has not lost momentum. The past decade has seen an explosion of knowledge about the human microbiome's role in health and disease. This has paved the way for promising new treatments targeting the gut microbiota. So, what have we learned about Crohn's disease? Firstly, it's a chronic condition that can affect any part of the digestive tract, from the mouth to the anus. Symptoms can vary widely, but often include abdominal pain, diarrhea, weight loss, and fatigue. Secondly, diagnosis often involves a combination of tests, including blood tests, endoscopy, and imaging studies. There's no single test that can definitively diagnose Crohn's disease. Thirdly, while there's no known cure for Crohn's disease, treatments can significantly reduce symptoms and even bring about long-term remission. These treatments include medications, nutritional therapy, and in some cases, surgery. Lastly, living with Crohn's disease can be challenging, but it's not impossible. With the right treatment and support, people with Crohn's can lead full and productive lives. To sum up, Crohn's disease is a complex and evolving field. From its first description in the early 20th century to the latest research into the gut microbiome, our understanding of this condition is continually expanding. And while there's still much to learn, the progress made offers hope for those living with Crohn's disease.